Pharmacology and alternative interventions for mental health disorders. So, the first disorder we'll talk about is anxiety disorders. So, primary medications that are for anxiety disorders are sertraline. A secondary medication would be venlafaxine, and the third type of medication would be benzodiazepines, or another short term for third medication option would be lorazepam. And alternative intervention for anxiety disorders is a cognitive behavioral theory, also known as CBT, highly effective for managing anxiety without medication. The second disorder we'll talk about is bipolar and mood disorders. The primary medication for bipolar and mood disorders is mood stabilizers known as lithium. Secondary medications would be atypical antipsychotics, which is known as quetiapine, and a third type of medication would be antidepressants, which are carefully used with fluoxetine with a mood stabilizer. And then alternative intervention for bipolar and mood disorders would be interpersonal and social rhythm therapy, which is known as IPSRT, which improves mood regulation. The third one would be personality disorders. The primary medications for personality disorders is for emotional derelaxation, also the pill known as fluoxetine. A secondary medication is a mood stabilizer for impulsivity, and that would be valproic acid. The third medication would be antipsychotics for severe symptoms, and that medicine will be called olanzapine. Alternative interventions for personality disorders is dialectic behavioral therapy, also known as DBT, which is a golden standard for borderline personality disorder. The next one would be schizophrenia spectrum disorders. So the primary medication for schizophrenia spectrum disorder would be atypical antipsychotics, and that pill would be Vespertin. And the secondary medication is typically antipsychotics, and that would be albuterol. And the third medication is clonazepam for treatment-resistant cases. And then an alternative intervention would be cognitive remediation therapy, which improves cognitive deficits, which this is all for schizophrenia spectrum disorders. Trauma and adjustment disorders. So the primary medication for trauma and adjustments would be Piraxine for PTSD. And the secondary medication is proazapine for nightmares. And the third medication would be an atypical antipsychotic in severe cases, and that would be olanzapine. And an alternative intervention is eye movement desensitization and reprocessing, which is known as EMDR. It reduces PTSD symptoms effectively. So some National Social Work Association ethical responsibilities and issues would be pill mills, which is advocate against unethical prescribing practices. There's also a thing as over-medicating, and as social workers would promote holistic, at least restrictive interventions. And then also big pharma is critic financial influences on treatment cases and affordability, which is very important, because a lot of why people don't get their medicine or don't take it is because how high their prescription is, even with insurance, and then without insurance it's even a lot higher. So that's difficult for people to get medicines, and they're not able to afford it but would like to be on it. Another one is political implications, and that is to support mental health policy reforms. And the last one will be ethical standards and social welfare, public participation, emergencies, and social and political action emphasize social justice and responsible advocacy. Then selected disorder would be bipolar disorder, limitations of medication. So mood stabilizers can have significant side effects like lithium toxicity and weight gain. Some individuals experience incomplete symptom relief or medication non-adherence. And then lastly, medications often do not address psychosocial aspects like interpersonal dysfunction and role impairment. Alternative pharmacology treatment for bipolar disorder. Intervention, which is family-focused therapy, also known as FFT. Effectiveness improves relapse rates, medication adherence, and family communication. And lastly, evidence. Studies showed that FFT, also known as family-focused therapy, plus medication leads to better long-term outcomes than alone. I hope you guys enjoyed my presentation on pharmacology and alternative interventions for mental health disorders.